That's very exciting. Medicine for diabetes has evolved so rapidly, it seems, over the last decade or so. And there are many options out there for patients. We want to give them the hope that we, as the medical community, physicians and other healthcare providers, can work together to get the blood sugar down, not just with medications, exercise and diet. And I often use this comparison of like a Lamborghini, that a Lamborghini is a fast car. And if you don't drive it, though, but you keep putting fuel in the tank, you're going to be standing in a puddle of fuel. Yeah. And the same thing with eating. Your body could be a Lamborghini, but if you don't drive it and exercise it, the fuel, you could put 93 octane in. And if you don't get into the gym, like you said, and burn the calories, it's all for naught. And we were chatting before the show a bit about different diets that might help people with hypertension and hypercholesterolemia, high cholesterol, and high blood sugar. We were chatting a bit about vegetarianism and vegan. What are some of the dietary tips that you're providing to patients now in your clinics, and do you have nutritionists that are working? What is the program? How do patients benefit from nutritional counseling?
Yeah, that's a great question. And I think, again, what we're learning is that, yeah, there's tons of diets out there. In some ways they all work, and in some ways none of them work. And it really needs to be individualized. And what that means is you may have a patient who is doing 12 things that are wrong. They're drinking sugary soda with breakfast. They're having cookies as snacks. They're eating French fries for lunch. But if you make them a list of all the things they're doing wrong and say, here's what we need you to fix, it'll last about an hour, and you'll see that piece of paper on the floor on the way out. So what we try to do is individualize it. We work with that patient and we say, there's lots of room for improvement in your diet. Most of our patients will know that. They know, they've heard the messages that French fries are not healthy, that junk food's not healthy, that soda's no good for you. But we throw it back at them and say, what do you think would make a difference to you? What do you think you could achieve and sustain? And they'll surprise us. Sometimes they'll pick the easiest thing, but I had a patient I saw a couple of months ago who said, I'm giving up rice. And this is a woman who grew up in the Caribbean. Rice was there on her plate every day since the day she could eat solid food. And she did it. I was shocked. I would never have recommended that to her because I thought, you'll never achieve that. And what she said, if I try to have this much rice, if I try to have the amount of rice that your picture in your pamphlet says, I'm never going to do it. It's never going to last. It's easier for me just to get rid of it, like the potato chip ad. You can't have one.
Right,
That's what rice meant to her. So she's taken the rice off her plate. She's filled it up with some vegetables that she enjoys. She's not eating anything new. She's just taken some of the unhealthy stuff out of the way. That worked for her. That's not going to work for most of my patients. But but throwing it back at them, cutting out soda for somebody who drinks 2 or 3 cans of soda a day, just getting rid of that, that's 600 calories.
Yeah, I mean,
right,
that's
600 calories.
That
may be all it takes. So I think really coming up with not just the education, but the plan that people can live with.
Yeah.
Because we don't want them to go cold turkey and then crash.
I just think it all comes back to that concept of you have to drive the car to burn the fuel, and you got to put the good fuel in.
That's right.
But one without the other.
That's right.
It just never. It won't work. It won't work. And the soda's a big point. There are many things in our lives like cigarette smoking, which we've been told over and over causes cancer, and we need to stop. But the sweetened beverages, the high fructose corn syrups, the high glycemic index foods that we eat, which spike our sugars. When I take a dietary history in my office, I find that if we were just to remove the sweetened beverages for some patients, when you add up the calories, where we say maybe 2,500 calories might equal a pound or so, by just discontinuing those, the weight can come down a pound a week by just replacing it with water.
I think that's very true. I think it's especially important in kids because kids, the juice box is always
Part
at
of
hand.
life, yeah.
And it feels healthy to a parent because it's juice and it's natural and those things are true. But you take the fruit and you squeeze out the juice and you throw away the rest. You're not left with a lot of healthy nutrients. You're left with a lot of sugar. And if the kids get used to that sweetness, It's going to be hard to
It's
give
hard to
up.
break that habit.
It's
The
hard to break
palate
that habit.
changes to where it only seeks out what we, as physicians, have been telling patients for a long time are unhealthy,
That's
high
right.
glycemic index foods. So when it comes to diabetes, just to review here for the folks watching, is it's not always going to be about medicine, but it's about our bad habits and about what we're proactively doing for ourselves, changing our diet, getting in the gym and exercising. And I like the teamwork approach that you have now at Kings County, where you're creating these groups, because social medicine, so going with a buddy, going with a group of 5 or 10 people and talking about your diets, getting cooking ideas, bouncing them off each other, is really a great idea. I think when we're in isolation, you're right, it's easy to just not show up to the gym and
Right.
pay the membership, which is what the gym wants.
Right.
So talk to us a little bit about the Diabetes Center. There was a ribbon cutting for a diabetes center over at
Yes.
your institution.
Yes, we were very proud. A few weeks ago, we had the ribbon cutting for a new expanded diabetes center. And what we've been able to do is put our clinical practice sites where our physicians, our nurses, our nurse practitioners provide the clinical care, prescribe the medication, do the blood testing, together on the same floor with full service educational behavioral program. We've got classrooms where we provide the American Diabetes Association's curriculum. So we send folks back to school, people who have new onset diabetes or have been struggling with it for a while, go sit in a class with 10 or 15 other folks just like them, and they sit and they get notebooks and they write their notes out and they learn, what do I do when I'm feeling sick? What do I eat? What are these medicines that I'm being given? And there's 6 sessions. They come in once a week. And we've been doing this for years now. And we just, every year, anybody who finishes all 6 sessions comes to our annual graduation. We had that this morning. And we had 120 people sitting in the room, some of whom had reduced their blood glucose and their hemoglobin A1C, which is the blood test
marker,
that measures diabetes, had reduced it to stone cold normal. Not just good, but normal. So that's one of the features that we have. We're also starting the diabetes prevention program, which is kind of what we were talking about before, where we bring people in groups, people who are at risk for diabetes because they're overweight, because they have family histories. And again, that's socialization, setting goals, that's a big part of it. We have a teaching kitchen. So we're giving cooking classes because if people are going to learn and put food on the table at home that they're going to enjoy, that their family is going to enjoy, and is healthy, they've got to learn how to do that. They know how to do the burger and fries. How are they going to learn how to put a salad on the table that people aren't going to turn their noses up? So that we have a full-service teaching kitchen, and we have a teaching gym, because a lot of our patients have been walking past those gyms, never signing up because they don't feel like they would walk in and be at home. They don't feel like they would know how to use this equipment. So they come in and we have trainers who will teach them how to use the equipment, what to set the exercise bicycle on, how to set the treadmill settings on, what dumbbell sizes to use, what exercises to use, so that they can then keep doing this. This teaching gym and teaching kitchen are right next to the exam rooms where the doctors are writing the prescriptions.
What does this cost somebody?
Our patients?
Yes.
So it's all part of the package. Being part of the New York City health and hospital system, our mission is to take care of patients without regard to pay. So the education program is, we don't charge the patients for it. We just provide that because we know that if we're going to get our patients to where they need to be, we've got to do more than just write the prescriptions.
That anybody can show up and benefit from.
Right. So the best way to do it is if you don't have a primary care provider, if you don't have a primary care physician, call up Kings County and make an appointment for primary care, and they will send you for what you need. So I can keep going because we have more going on there. We're also, for patients who have not been able to lose the weight despite doing everything they possibly can, and it's really affecting their hypertension, their diabetes, and their well-being, we're actually planning bariatric surgery, weight loss surgery, which we expect to start sometime over the next year.
All involved in this comprehensive center.
All in the same center.
So for viewers watching today who hear about this fascinating service, which sounds like all we've ever wanted to do in medicine for our patients, which is combine education about cooking, how to exercise, how to cure our diabetes, or at least get it under control, is all under one roof. And it's not going to discriminate in terms of who can pay, what insurance. They have to just be linked into your system.
Right.
So they can go to your website, the Kings County, the Health and Hospitals website.
Right.
They could find this. They could find a number to call. So if you're watching today and you've always wondered about how do I find comprehensive care for my diabetes, I don't know how to conquer my diet or my exercise schedule, here it is.
That's right. Go
It's
to the website.
Yeah.
If you don't have internet access, you can call the city's helpline 4211 and get the information you need and get sent to either Kings County, or if you live in one of the other boroughs, we have sister hospitals and outpatient centers throughout the 5 boroughs.
I love the idea. It's fascinating to me. It seems like everything I've ever wanted for my patients who have chronic conditions like blood pressure or diabetes is to be able to get medically supervised education, not what we find Googling on websites and looking for things that may not have the best credentials on the internet. You know, we have to be very careful of what we find out on the internet, because some websites may claim cures for these diseases that are quote unquote natural but may be very dangerous. So seeing a physician at your institution, getting involved in primary care, it sounds like this is one of the most incredible comprehensive care programs. I can't wait to hear how this goes in the future and see the outcomes from it. There's one very interesting program that I want to just let our viewers know about quickly, and we've got a minute or so to touch on this. If they can't afford to buy healthy food, they can't afford to buy the vegetables, it's easier to pay 99 cents for the French fries than maybe a few bucks for a salad, and that can make all the difference for somebody. You have a program to help.
Right. Well, there's a few things we can do. First is we want to make sure anybody who's eligible for SNAP benefits for food stamps gets enrolled, and we will enroll them right on site for that. There's also food pantries that are available throughout the city that don't require food stamps, but they don't always have the most healthy food. Many of them are working on it, but what we're trying to put together is what we're calling a food pharmacy. Again, coming back to this theme that what you eat is just as important as any pills that you may be taking, sometimes more. So we're trying to build on some of the work that other systems in other states have done to link their medical care for people who have diabetes or are at risk for diabetes, and give them prescriptions for healthy food and provide it. We can't provide enough food for the entire family for the week, but we can provide a supply of fruits and vegetables and some other staples, some other whole grains.
This is incredible. I mean, you're offering education, dietary counseling, the ability to obtain the food when possible.
Right.
And so I want to thank you for coming on the show and talking about these fascinating events and fascinating progress at New York Health and Hospital, Kings County. Thank you for coming, Dr. Stevens.
It's been a pleasure.
Thank you. Thank you for your interest in our show. I invite you to check our website, medcastplus.com, and connect with us on social media. You can also call us at 718-510-2103. I'm Dr. Braha, and from all of us at Medcast Plus, stay healthy, Brooklyn.